So, welcome to all my dear student. This session continue with the antacid. In the previous session, we discussed about introduction and classification of antacid. So, and before this class, I am going to discuss with you about acidifier or acidifying agent. What are the acidifier or acidifying agent? Before entering into the topic, let's see about the introduction of GIT. That means the digestive system is the gastrointestinal tract, which is a group of organ. It extends from the esophagus to the anus. So the entrance to the system is the buccal cavity. We know already. So what is the starting point from the entrance to the system is the buccal cavity. The main portion include the stomach, the small intestine. The small intestine has duodenum, jejunum and ileum, and the large intestine cecum descending, and the large intestine cecum ascending, transverse and descending columns, and the rectum with the exit anum. So the GIT tract, it starts from buccal cavity and it travels through esophagus and thereafter stomach, from the stomach into small intestine and large intestine, and at last the rectum with the exit anus. So this is the proper digestive tract. Next, stomach. So what is the function about stomach? In stomach, the digestion of protein in acidic medium takes place. Here the digestion of protein in acidic medium takes place with pepsin enzyme. Both acid, hydrochloric acid and enzymes are excreted in the stomach by specified cells. So here stomach, we know it secrete the excess of hydrochloric acid, so that here antacid used to antacid, which are alkaline substance, used to neutralize the excess of acid, whereas acidifier so used for the treatment of systemic alkalosis. That means excess of where the excess secretion of alkaline substance. So in order to increases the acidic layer, so here acidifying agent or acidifier to be used for the alkalosis process. Okay, so here in stomach, digestion of protein in acidic medium takes place with pepsin enzyme. Both acid, hydrochloric acid and the enzyme are secreted in the stomach by specified cells. Small intestine. In small intestine, the digestion of the following changes takes place. Digestion of protein takes place in alkaline medium. See, whereas digestion of protein in the stomach takes place in acidic medium, but in small intestine it is takes place in alkaline medium in presence of enzyme. Next one, the digestion of carbohydrate and lipids takes place in the presence of enzyme and bile salt. Next, absorption of digested food, vitamins, minerals takes place. Absorption of digested food, vitamins and minerals takes place. Whenever the above function go wrong, they occur disease or undesirable condition. Some of these are as follows. Like for example, if the function of stomach fails to secrete the excess of hydrochloric acid, thereby the person caused to hypochlorhydria. Hypochlorhydria is nothing but decreasing the level of or inadequate secretion of hydrochloric acid. So that time the person may be treated with acidifying agent or acidifier. So that will increases the acidic nature of our stomach. Okay. So whenever inadequate secretion of acid takes place in the stomach, so this causes achlorhydria. What is the term known as absence of hydrochloric acid or inadequate secretion of hydrochloric acid? Achlorhydria or hypochlorhydria. Hyperchlorhydria is differ from hypo. Hyper means increasing the level of hydrochloric acid. Hypo means decreasing the level of hypochlorhydria. Or achlorhydria is nothing but absence of secretion of hydrochloric acid. So whenever excess secretion of acid takes place in the stomach, so this causes the imbalance of acid enzyme ratio, thereby finally leading to hyperacidity and ulcer. Gastric and sometimes duodenal wall becomes sensitive, giving rise to acute pain. Why? Because sometimes the gastric and sometimes duodenal wall becomes sensitive, giving rise to acute pain. So there may occur accumulation of toxic substance or gases. Suppose in case of the absence of secretion of hydrochloric acid in the stomach means, so what are all the difficulties may face the patients, or the difficulties or accumulation of toxic substance or gases. There may occur inadequate absorption of fluids and minerals from large intestine, thereby causing diarrhea, and there may occur insufficient peristaltic movement of large intestine, thereby causing constipation. The patient suffered by constipation. There may occur inadequate section of absorption of fluid and mineral from large intestine, thereby causing diarrhea. So there may occur insufficient peristaltic movement the large intestine, thereby causing constipation, and inadequate secretion of saliva, thereby making the food to swallow with the difficult. There may occur ingestion of poisonous substance and accidentally or intentionally by some process. So it is possible to correct the above condition. So what are all the problem or difficulty means, if the absence of hydrochloric acid or insufficient secretion of hydrochloric acid means, so accumulation of toxic substance or gases, inadequate absorption of fluid or mineral from large causing diarrhea, and in some there is a proper peristaltic movement of large intestine, thereby causing constipation, and there may occur inadequate separation of saliva, thereby making the food to swallow with that difficulty. There may occur ingestion of poisonous substance accidentally or intentionally by some process. Some So it is possible to correct the above condition by administration of suitable drug. In subsequent pages, an attempt has been made to describe several inorganic compounds that find application to the conditions. First one, so it also include related to inorganic compound like the some in order to that problem to solve the inadequate secretion of hydrochloric acid, here we may go with that acidifying reagents or acidifier. So what are acidifying agent or antacid mean? So these are the drugs which are able to increase the acidity in GIT. Some of these drugs are used to increase metabolic acidosis, whereas some of these are used to increase the gastric hydro. See, some patients suffering from achlorhydria respond to stimulation by histamine. For example, achlorhydria means absence of hydrochloric acid. In that case, some of the drugs like histamine, if we are giving to them person suffering from chronic alcoholism or tuberculosis or hyperthyroidism and elderly person above 50 years by histamine patients. On the other hand, some patients suffering from carcinoma, some patients suffering from carcinoma of the stomach, chronic gastritis or gastrectomy, there occurs a total achlorhydria. So such patients can be treated by administration of hydrochloric acid. Next, the classification of ice and acidifier can be classified into urinary acidifier, next systemic acidifier or acids. So example for urinary acidifier, these are the drugs which are used to render acidic urine to enable treatment of urinary tract disorder. So the person suffering from urinary tract disorder, so in these drugs will helps to render acidic urine to enable treatment of some types of urinary tract disorder. So, and in case of this is the specific organ where acidifier used as a to treat or achlorhydria or hypochlorhydria. Next, systemic acidifier, the term itself, it is used to neutralize the alkaline body fluid, particularly blood. These are the drugs which are able to neutralize the alkaline body fluid, particularly blood, in patients who are suffering from systemic alkalosis. So systemic acidifier mainly used for the treatment of systemic alkalosis. Next, antacid. So these are used as pharmaceutical aids in preparation, laboratory, quality control. So this will be declared somewhere in the book. Next we'll see example for acidifier. I already told you acidifier differ from antacid. Antacid, these are the drugs which are alkaline substance, help to neutralize the excess of acid, whereas acidifier used for the treatment of systemic alkalosis, thereby which will increase the level of hydrochloric acid. Next, what is the example for acidifier or acidifying agent mean? Dilute hydrochloric acid, it contains 10% weight by weight of hydrochloric acid. So what is the normal percentage? 9.5 to 10.5%, 9.5 to 10.5%. So what are the ingredients to prepare hydrochloric acid? Purified water. Next, the hydrochloric acid, 274 gram is added gradually to water, that means making the volume with the rest of the volume with the water and mixed. Next properties, it is a colorless liquid, it is strongly acidic and has about 1.505 to 1.05 specific 05 specific gravity. Next one, it complies the test 1 and 2 which have been already described under hydrochloric acid. So weight for ml of 25 degrees Celsius is 1.05 to 1.05 gram. So test for purity. So here we may carry out test for arsenic, chloride, acid consuming capacity, metals, heavy metal, and sulfate and free chlorine, etc. So now next we'll see about the assay. The procedure has been the same as discussed under hydrochloric acid, using 10 gram of the assay procedure has been the same as discussed under hydrochloric acid, using 10 gram of accurately weighed sample. So what is the use of acidifier or acidifying agent? So it is used as an acidifier and stored to be well closed container. Dose 0.6 to 8 ml. So here glutamic acid is 70 milliequivalent, consists of used in the form of